All right, well, if we're ready, we'll go ahead and get started. I just want to thank everyone for joining us today. I really appreciate those who are able to be in person and those who are online actually joining us. And I'm sure everybody's heard this in the Zoom world over the last year, but make sure if you're on Zoom, you are muting your microphone. Feel free to submit questions over the chat feature while you're watching, and we will get to those at the end of this event. And we will respond to as many of those questions as we can, making sure we have enough time for that. So I am Jan Kulmann. I'm the mayor of the city of Thornton, and I'm actually going to turn this over to our mayor pro tem, Jessica Sandgren, to kind of introduce some things about our business center.
Thank you, Mayor. So I'm Jessica Sandgren, Mayor Pro Tem and City Councilwoman in Ward 2 for the City of Thornton. And I'm very excited and welcome everyone for being here virtually and in person. This is our new Alliance Business Center, and we are a bilingual English and Spanish business assistance center. The Alliance Center is a new small business resource designed with COVID safety in mind and built in partnership with some amazing business service providers. So this is all in support of Colorado's small business community. We provide in-person and virtual assistance to small businesses. Staff and counselors are fully bilingual, and there's free business counseling in partnership with North Metro Small Business Development Center, Mikasa Resource Center, and Mile High United Way for Business. Other services include free meeting space, free technology such as Wi-Fi, laptops, and Zoom, free workshops in partnership with SCORE Mentors and Ramos Law, and many other great partners. They also provide technical assistance and guidance for startups and existing businesses as they navigate through the many great resources and programs available to support them. So there will be a link in the chat box where you can learn more about the Thornton Business Center, and hopefully you're seeing that now on the screen. And back to you, Mayor.
Thank you. So again, thank you all for joining us. We are very excited to bring this panel together today. Today we have Dr. Joseph Ramos from Ramos Law, and online we have Mellissa Sagar from the Tri-County Health Department. And they're going to talk to us a little bit today about COVID safety for businesses and the COVID vaccination. So Dr. Ramos, why don't you introduce yourself and tell us a little about you?
Well, thank you, Mayor Kulmann. It's a pleasure to be here. I'm the principal of Ramos Law. I'm a medical doctor and an attorney, and the reason I'm here actually today is because of what I think of small business. Now I support small business. I also get to use my love of medicine and talk to you guys about COVID. So for me, it's a huge win-win for just the opportunity to present to you guys. The other thing is this touches my heart closely, the Alliance Business Center here, because I came from a family who didn't have any business. My mom got pregnant when she was 16. My dad was 18. My mom's a janitor. My dad is a mechanic. And I know what it takes to get started in business. And I highly respect all of your time and your interest in doing so. Are we doing this in Spanish also? Because I just talked a whole heck of a lot if somebody's going to translate.
We are.
this.
We have a translator who's helping it
Ooh.
be broadcast in Spanish as we talk.
I apologize.
He's really good.
He must be really good. He must be really good. So this touches my heart. And before I start, a little just to touch more about myself, I want to say thank you to the Alliance Business Center today. Translate. I had the opportunity to spend my whole afternoon here, and this place is impressive. If anybody's watching online, you've got to come see this place. The facilities are first class. I used their computers today, their internet today. I did a live bar licensure all the way in New Mexico from here today. And it was a wonderful experience. So my hat's off to what you guys have done, Mayor Pro Tem, and the city here, you guys for participating. This is outstanding. I don't need to say much else about myself. I've already said that I'm here to help and support business in any way possible. At the end of this, if any of you would like my email address or personal contact information, I'm happy to give it to you. If there's anything I can ever do to help any of you, I'm happy to do so.
Thank you. Yeah, we're very proud of this business center as well. It's been one of the things that our staff has worked on it was before COVID, but COVID really made it into something that we could use. So thank you for that. I used it myself as well. I was sitting in another conference room doing my day job before this event. So yeah, I agree with you. It's really great. And then online, we have Mellissa Sagar with the Tri-County Health Department. Mellissa, I'm going to let you introduce yourself as well and give us a little bit about your background.
I'm going to do my best. It's still very challenging to hear you guys. My name is Mellissa Sagar. I'm the Policy and Intergovernmental Affairs Manager for the Tri-County Health Department, your local public health agency. We represent Adams, Arapahoe, and Douglas counties, about 1.5 million folks across those 3 counties around the Denver metro area. Our jurisdiction includes 26 municipalities, 15 school districts, so many businesses. Traditionally, we are not working with such a broad range of businesses. We do this type of public health work very closely with many businesses, primarily restaurants, but also child cares, your pools. So we're used to working with businesses and working on compliance with requirements to keep the community safe and healthy. But this has been a new landscape for us, and it's been so great to connect with all of you on a regular basis. I'll say this a few times, but to join us for our weekly webinars. For our restaurants, we're doing bi-weekly Monday webinars with our chambers of commerce, regularly connecting with our cities and county elected officials, and just great to connect with all of you. And I'll mention our webinar again, but you can find it on our business support page. If you just Google TCHD business support, lots of great information there. But just happy to be here to chat with our businesses, tell you a little bit about the services we provide, hopefully answer some of your questions. You'll definitely notice that a lot of things are unknown. I'll mention quite a few times that they'll keep changing, which is just so hard to keep up with. And we know it's so challenging for our businesses, but hopefully emphasizing the resources that we have to offer and just answering questions along the way. I think, we see what a challenge this is for our businesses. And as soon as everyone figures it out, it just changes tomorrow. And we'll see on a press release with the governor, a press conference tomorrow, what changes. And it's going to keep changing. And we're doing the best we can in this new territory. And we know that many of our businesses are doing the same. So bear with us, and we'll bear with you as we try to build this plane together and fly it. And that's what we've been doing, and it's been great. Our businesses have been fantastic partners, and we've learned a lot. So yeah, that's what I do, and I'm excited to answer some questions.
Thank you so much, Mellissa. We really appreciate that. And I know I'm on the call with Tri-County Health every Thursday afternoon, and you guys do a great job keeping the elected officials informed, so I appreciate that. So Dr. Ramos, I'm going to start with you, actually.
Okay.
COVID-19 has had a huge impact on our city and our residents, but most importantly, our businesses. Can you tell us what science has learned over the last 12 months about the COVID-19 virus?
Wow. Yeah, that's a big question. I'll try to answer it fairly concisely. What we've learned is that COVID-19 really is the perfect bad virus. And I say that for several reasons. Maybe one of the easiest ways to understand that is to compare it to the common virus we all hear about all the time, which is the flu. And so when I'm done with these comparisons, you'll understand what we've learned. For example, with flu, you often can transmit it maybe one day before you get it, or you have it. So you get infected, and you can transmit it for a day when you don't know you have it. And you might have symptoms for 2 or 3 days, and you may transmit it during those times as well. And then you're no longer infectious. With COVID, the asymptomatic period has been anywhere from 2 to even 4 days that people are running around and don't know that they have it. So you're getting a lot of people that otherwise don't know they're ill, but they're infecting people. The other thing is instead of lasting 2 or 3 days, it's lasting as long as 10 to 14 days. So you can see where that's ripe for being spread everywhere. It's easy, also very easy to get. It hangs around in the air with a whiff for potentially as long as 14 hours in some cases. They found that it lives on some surfaces like masks for as long as 5 days. So unlike other viruses that frequently die very easily, it seems to hang around. And then the last thing about it is it's one that's just easy to get. A lot of people will get the disease. And Mayor, I have some statistics I wrote down if you want me to share numbers.
That'd be great.
Okay, so those factors make it the perfect bad virus. Here are maybe some encouraging statistics about it. Certainly the overall numbers are not encouraging. There have been 28,065,327 cases of COVID in the United States. Of those, there have been 501,181 deaths. So it's a lot of deaths, but it's a lot of people who are getting the virus. The 7-day average is, as of this morning, they had reported the 7-day average of infected people has decreased by 9%. Hospitalizations now have had a 68.9% decline in hospitalizations. The Colorado cases, to speak more about Colorado instead of nationally, here we've had 423,558 cases as of this morning. Of those 423,558 cases, there were 5,837 deaths of Coloradans. That's about 1.3%. Most of the deaths, as you may have heard, have been in the elderly. They've been in diabetics. They've been in people with coronary artery disease or heart conditions, underlying respiratory illnesses, or people who are immunocompromised, like from cancer treatments. So the virus hasn't done a very good job at killing healthy people. Now we hear about those deaths a lot in the news, but that's probably not a good representation of actually the death rate of 1.3%. And then lastly, I would just tell you that in our state, we've tested over 6 million people, 6,080,273 people have been tested. So there's been, and of those tested, 5.9% of everyone tested, you see those big lines, about 5% of those people will be positive. Okay, so those are some of the statistics, Mayor, of what the disease has done and how it's affected our communities and how it's affected us nationwide.
Thank you.
Thank you. All right, Mellissa, I'm going to ask you a question here. So there's so much information coming each day from CDC and Tri-County Health, and you did touch on this a little bit in your introduction. But why is it important for the businesses and the business community to stay connected to you so that they can understand what the guidelines are and how those changes are impacting how they run their business?
Yeah, happy to answer that. So I think really the short answer to that question is to keep their employees and the community safe. Just outlined some of what we know about COVID-19, and the fact is it's dangerous for many, many folks. And so we ask our businesses to comply with these rules for the same reason we ask everyone to comply with them, to protect our neighbors, our family, our friends, that may be vulnerable to severe complications from COVID-19. And we've seen this play out in the community, and we've seen what creates risk of spread, and some activities are riskier than others. And so some of our businesses have to be extra careful with what they do. But ultimately, each of those steps plugs a little hole in the Swiss cheese of COVID-19 spread. And anything we can do to plug another hole to protect one of our vulnerable community members is good work. And we know lots of what we can do. And there are a lot of complicated guidance documents and recommendations and the public health orders and amendments to those orders and executive orders and press releases and Governor Polis on Facebook Live. And so it's coming from everywhere, and it's tough to keep up with. But at a very basic level, we know that keeping our distance and keeping our masks on protects folks. And so anything we can do in those business settings to keep non-household members apart, to keep things sanitized and clean, and to keep folks in masks is going to help stop the spread of COVID-19. And so that's what we ask our businesses to do. And the rules have evolved, and we support that because that means the state's reacting to what they're learning. We're learning a lot. We're learning from our businesses. We're learning about the disease. Community conditions are changing. People are getting vaccinated. And so the state's making changes as a result of those community conditions. So we'll keep encouraging them to do that. We know that it's tough for our businesses to keep up. And so we'll keep chatting through these changes. But again, 6-foot distancing, wearing a mask, staying outside if you can, washing your hands, staying home when you're sick, very basic levels. Anything we can do in the business setting to adhere to those is going to help stop the spread.
Thank you, Mellissa. And you mentioned there's a lot of information out there. Can you tell us where businesses can find the most current information and updates from your office?
I'll mention our Friday webinar again, and I'm not sure where the best place to put this information is because I have a link to share, and I know you all have this. Again, TCHD Business Support. If you Google that, our page is going to come right up. Google is your best friend. I'll say that as a place to find information. 2 really important acronyms. TCHD is your local public health agency, and CDPHE is your state public health agency. And if you're looking, whether it's cleaning guidance, symptom screening guidance, the latest dial changes, if you use those acronyms and those words, information is going to come up. And I encourage you to keep an eye on those websites, our website and the state's, for updates. Again, changing rapidly. Our Friday webinar, and then I'll give you our email address. We have when this pandemic started, after a few weeks, we created a group specifically designed to work with businesses because the volume of questions and the confusion was just so huge, and it still is. And so we have a whole team of folks, our business reopening task force, ready to answer questions. And we encourage folks to stay in touch and keep reaching out. The email address is covidbusinessrecovery@tchd.org. Really, that's the best way to get the latest information, reach out and jump on our webinars.
All right, great. Thank you so much for that information, Mellissa. I'm going to turn it over actually to Dr. Ramos again. So there's a lot of information, again, as we've heard from Mellissa, for businesses to be aware of. And so we know, we've heard from them, I'm sure you're aware as well, there's just a lot of stress and uncertainty in how they're running their day-to-day business and whether or not they're even going to be able to stay in business. And so it's important that we do what we can to support our local businesses. And so Thornton does have a pledge called Stop the Spike. And so that really is helping them to understand what they need to do as far as limiting gatherings, wearing their masks, washing their hands. And then we've also encouraged just shopping local. So making sure that we're supporting our local businesses by purchasing and then any other service needs that we might have. But what else can people do to support small businesses and help make sure that we're stopping the spread?
Well, Mayor Pro Tem, I think there are several things you can do to help the local small businesses. From a safety perspective, you've heard many of the things that were just said. Cleanliness, hand washing, masks, appropriate distancing. I would tell you something simple that you could do. It's just that general respect to the business managers or owners. There's a lot of stress that they're already under in their businesses financially. They're not happy that they have to set people apart or tell people to wear masks or do any of that. And we don't add anything to that when we give them a little grief over it, regardless of what our beliefs may be. So one of the best ways to support your local small businesses is not only to show up and do business with them, but to love on them while you're there. Because they're like all of us. They're not any happier than any of the rest of us. When you're in the businesses, simply following their rules, a lot of the rules through the programs you've just mentioned are in place, they're effective, and they're working, and follow the rules. That's how you can help the businesses locally while you're in them. How you can help yourselves is this. I don't know if you've ever noticed, but there may be a time in the past where you got a cold, and it was after you were up all night, or after you did something really stressful, you were outside, you got cold, you didn't sleep very well for 2 or 3 nights in a row, what do you know? You come up sick. And the reason is you've stressed your immune system. Medically, you've stressed your immune system. And COVID, anytime that our immune system is stressed, we're more susceptible. That's why elderly, that's why diabetics, that's why people with underlying respiratory diseases, they already have stressed systems. So they're susceptible. We make ourselves susceptible. If you're healthy, you make yourself susceptible with that stress. So the things that you can do in your own life to decrease stress, get adequate sleep, exercise, properly balanced diet and nutrition, some of the basic stuff really matters. With COVID, it really matters. And as we've seen stress go up in society, alcohol use go up in society, we've seen our immune systems all drop, and we've seen all of us become more susceptible. From a nutritional perspective, there's a lot out there. I will tell you that most all of it is gimmick. So be careful what you read and what you buy as far as getting the magical nutrient. There's really only been one thing proven through scientifically validated studies to boost the immune system, and it's vitamin C, believe it or not. Vitamin D has some excellent studies now as well. And so I myself, if you want to know the supplements that I use personally, I use vitamin D, I use vitamin C because of their antioxidant capabilities and proven scientific immune boosting capability. I also try to have a well-balanced diet. And there's one other nutritional thing I do. A lot of viruses are known to replicate in mucosal epithelial cells. If you notice when you go to get tested for COVID, they do a nasopharyngeal swab, they stick it all the way in the back there, and they get mucus from the back there. The reason that that's where you're tested is because it's where the virus likes to replicate. And one of the things that they found with many viruses that interrupts that replication is zinc. So sometimes I will just take those zinc tablets you can suck on because I'm soaking my mucosal epithelial cells. I believe, based on other science with adenovirus, which is the cold virus, that I'm probably decreasing the replication of virus. So those are some general personal ways you can support yourself, and there's, kind of common sense ways you can support your local businesses.
Thank you.
Sure.
And you touched on this a little bit in the beginning. The flu is a virus that we're very familiar with. And while we've seen a significant decrease over the last year with COVID, can you tell us the differences in the symptoms between the flu and the COVID-19 virus?
Yeah, I'll give you a very political answer. In all seriousness, it's very difficult to tell. And it's why early there was probably quite a bit of misclassification of flu virus and COVID when we were basing it on symptoms. The reason is that the most common symptoms of COVID, headache, fever, muscle aches, dry cough, nasal discharge, are all symptoms of influenza. Exactly. So when you try to differentiate, there hasn't been something that jumps out. When they look at things like diarrhea or GI symptoms like nausea, they found that that's a minority of people with COVID, 20 to 30%. It's also the minority of people with influenza. So there hasn't been a real ability to differentiate. If there is one differentiating physical factor that people with COVID have suffered, it's the loss. There's a pretty good share of people that suffer from a loss of smell and a loss of taste. Now that is unique to COVID, and we differentiate it from influenza. But otherwise, Mayor, it's very, very difficult to tell the two apart. And that's why we have the testing. That's why we have social distancing and all of the things to isolate when in doubt.
Thank you.
And so, touching on that, since they are so similar, how should you determine when you should actually go to the hospital versus just stay home and rest?
Yeah, that is a great question, Mayor Pro Tem. I had many friends of mine tell me, physicians that were working shifts in the hospital, tell me, hey, listen, tell all the people going to your clinics, tell them not to come here if they think they have COVID, which is exactly the opposite of what you'd think, right? And the reason is that symptoms don't equal some special treatment. Treatment for COVID is supportive. And what does supportive mean? Rest, fluids, nutrition, medicines to break the fever. Those are all things you do at home. So people were getting fever and they were getting cough and they probably had COVID and they were going to the hospital or they were calling into the hospital and they were being told, don't come here. We just assume you have it, stay home and isolate. The reason is they had nothing to offer you. So when you go in to answer that question is this. We mentioned earlier that COVID gets people's respiratory systems. We talked about the nasopharynx, an area where it infects. Most of the COVID cases are killing people with respiratory or cardiac complications. So if you have underlying, asthma, underlying COPD because you're a smoker, underlying anything really with your respiratory system, if you have underlying heart disease, if you had a prior heart attack, now you're at a higher risk. Now that doesn't mean go in, but here's what it does mean. If you get an experience shortness of breath, difficulty breathing, chest pain, if somebody looks at you and realizes that your color is a little different, that's often a sign of oxygenation. You may have seen someone in your past that looked a little pale or their lips looked a little bit weird. That's because of their oxygen status. Because COVID likes the lungs, oxygen status is a key to who should go to the hospital and who shouldn't. Because of that oxygen status, imagine someone who already has a challenge with coronary artery disease. They can't get enough blood flow into their heart because their vessels are constricted down. What happens when you decrease their oxygen? You now put their heart at risk. So those are the people, if you're experiencing any sort of respiratory symptoms, if you have underlying condition, if you have any sort of chest pain, those would all be emergency signs that you should go directly to the hospital rather than stay home, rather than call your primary care doctor. You'd want to go directly in.
Great, thank you.
Sure.
And Mellissa, I'm going to throw this one back to you. The Alliance Center receives a lot of questions from employers regarding their legal responsibilities with COVID sick leave. What are an employer's legal responsibilities when it comes to this sick leave, and how many days of paid sick leave are they required to give their employees?
Thanks for the question. I am not going to go through in detail because it depends. And that's the case with many of the legal questions that come our way. And what we do within our group is really make connections to trusted resources from federal agencies, state agencies. The requirements vary, and I'm going to share my screen really quickly to show you this poster from the Colorado Department of Labor and Employment that goes through all the requirements for paid leave. It's actually required that our businesses post signage regarding paid leave requirements. And if you go through, depending on the situation, the type of employer you are, how many employees you have, will dictate what the paid leave requirements are. Colorado did pass paid leave requirements specifically for COVID-19 that then go into coverage more broadly. Those are in effect now, and the majority of employers are required to provide some type of paid leave. And so I'll make sure that a link to this document gets out to all of you. I will, our team has this, so reaching out to our team at COVID Business Recovery at tchd.org. A good way to chat through this will connect you to these resources, and then supporting documents for this. And not just this, similar resources exist for a variety of these questions from a variety of different agencies and entities that are working on this. I'll quickly say those organizations that you're very used to working with, whether it's your local government, your chamber of commerce, your regulatory agencies that regulate the activities. Lots of these entities are, putting out resources, actively gathering new information relevant to businesses. They're trying to be supportive. And so check there too. As this evolves, there's not always a nice, clean, albeit overwhelming poster that summarizes requirements, but folks are actively putting any kind of resources that could be helpful together. And then as you have questions, we are connected to these state agencies and we're taking those back to them. We need another poster for this. We need to know what the requirements are in a clear way that we can articulate that to businesses. And they're working on those. So reach out. This is the poster for paid leave, and it depends. If you have specific questions, you can reach out to us. Good to reach out to the Department of Labor about this specifically. And then, of course, your regulatory agencies will have some assistance as well.
So Mellissa, I'm going to ask you another question. We get this quite a bit, actually, several emails pretty much every week. And so we're getting a lot of questions about the vaccine and employer responsibilities concerning their staff. And so the main question that we get is, can an employer require their employees to get the vaccine? And then if they don't get the vaccine and a COVID outbreak occurs, could the employer be sued?
Yeah, it's, we know that there are a lot of these concerns. I'll share my screen again very quickly. An organization called the Network for Public Health Law has a great document summarizing the landscape here for COVID-19 vaccine requirements from your employer. Generally speaking, employers can have vaccination mandates. Medical providers do this a lot. Our hospitals do this. Your local public health agency who has nurses and doctors that see patients. But this is a great resource that summarizes all the issues. One thing that makes this a little bit different is the approval process for the vaccine. And honestly, maybe Dr. Ramos can talk about this a bit more, but it's an emergency use authorization. And so it follows just a bit of a different process than a traditional vaccine. And so there are questions about whether vaccine requirements under an emergency use authorization. But this document covers that. And you can see here it says most likely yes. But this is uncharted territory like much of what we've been handling.
Thank you. And I've got one more questions for you, Mellissa, before we open it up to the audience to ask their questions. When do you expect the vaccine to be available for essential businesses?
It's the question of the time. It's tough. I'll pull up, since I have my screen shared with you anyway, and I'll show you how Google is really a fantastic tool here. So CDPHE, that's our state health department. This is where our public health orders come from. Again, your local public health agency, we can issue our own, but the orders that our businesses are under currently is a statewide order. And so like our public health orders, vaccine distribution is also done by the state. And so they are in charge of this vaccine distribution. And we've seen it play out a bit over the last few weeks. And this critical workers category here in this chart is the most up-to-date resource. And we expect updates about this tomorrow. And so I'll pull up the state's main page. But if you Google COVID CDPHE, their main page, keep an eye on that. The governor will be making announcements tomorrow afternoon, and we expect some of those may be related to vaccine distribution. So critical workers is a very big category. It's hundreds of thousands of people, and we do not have enough vaccine to vaccinate hundreds of thousands of people. And so this category, as it opens, is likely to be gradual. And we've seen this happen already. We've seen teachers as critical workers pulled out and escalated up. This category of frontline essential workers is enormous. It is our grocery store clerks. It's our judicial system, it's our, everything, transportation, construction, bank tellers, places of worship, faith leaders. The category is huge. And so we expect the state to break this down a bit more. We don't know what that will look like. It is truly a Sophie's choice of decisions that the state is making. A lot of people want the vaccine, and it is just such a limited resource. And so we have almost met our metric of 70% of 70-plus-year-olds vaccinated. We moved through that group at a good pace, and we're almost to that 70%. One thing about 70-plus-year-olds is that there's less vaccine hesitancy in that group. And so we're chatting through what it looks like to connect with folks and provide information to folks who are undecided about the vaccine. But we're working through all of those issues and gradually opening this up. So we expect that announcement from the state tomorrow afternoon, and you can keep an eye on their page, the governor's Facebook page streams it, your local news. If you log on tomorrow afternoon, and I don't think they've announced a time quite yet, we expect some updates. So a long way to say it's open to some of our critical workers, and it will continue to be opened to additional categories of critical workers. And the more vaccine we get, the quicker we can open those categories. And the Johnson & Johnson vaccine is making great progress. And so we're really excited about that because that'll free up more vaccine and allow us to open these categories quicker.
Thank you very much. So with that, I'm actually going to lean on our City of Thornton staff to help get some questions from our online group.
Okay, yeah, they didn't have any questions in the chat, so.
No questions in the chat. Well, we can keep talking. That's not a problem.
I never have any problem with that.
Do we have any questions from the audience?
Does anybody in the room want to ask a question?
No, too shy?
I want to tell you guys something, if you don't mind, that came
Please.
up there as we were talking. Because I'm not too sure if I understood this statistic that was given regarding the number of vaccines that have been out there. I looked up with the CDC before I came in here, and as of February 18th, there have been 57 million vaccination doses administered. But unfortunately, that only represents 12.4% of the population. So there's a long way to go. If that's only 12%. Of people receiving second doses, there were 16 million, and that's only 4.9% of the population. Because one of my questions I had professionally was, is this decrease that we're now starting to see, is this related potentially to the vaccination regimen? It doesn't appear to be so much just yet, with only 12% having received it and 4.9% getting the second dose. They are right now vaccinating an average of 1.6 million people per day in the United States. If 57 million only represents 12%, then even at 1.6 million a day, we've got a long way to go. And so I would imagine that all the current precautions that you're currently seeing and using are going to be in place for a while.
Yeah, that's good to hear that there is a plan and there is a light at the end of the tunnel, right?
There is.
So maybe there's something you can explain to us on the vaccines themselves. So we hear a lot about the efficacy or the viability, right? And the Moderna and the Pfizer are 95%,
Yes.
but the Johnson & Johnson is only 75 to 80%. What does that mean?
So what they do, the question is, thank you, Mayor, the question is basically the efficacy of the vaccines, and they give these percentages as to how beneficial they are. Basically, how do they determine it? What does that mean? Maybe even which vaccination should you consider? You have to remember the whole course of vaccines, and if any of you watched about a month ago or 2 months ago, we gave a talk where I actually talked about some of the factors associated with the vaccinations. They really rushed this process to get this vaccination for obvious reasons. To give, by way of example, most times to get a vaccine to market, like the influenza vaccine, takes 7 to 10 years. They did this in like 6 months. So a lot of even the studies on the actual effectiveness of it probably still have some learning to go, so to say, to be accurate. I just saw a recent study now that the most recent cohort of Johnson & Johnson people tested were in excess of 90% effective. So what does it mean? Let's go to that. What it means is that you've received the vaccination and you've developed antibodies against the virus. That's how they determine how efficacious the vaccine is. So if they give it to a bunch of people, and so for example, let's say if it says 94%, you can look at that as if they gave it to 100 people, 94 of them would form antibodies, and therefore we assume that they're then protected against infection. And so that's how you would use those numbers. There would still be 6 people, perhaps in that example, that received the vaccine that still weren't protected. And what we've seen with some of the people who aren't protected now, and actually Colorado's famous for one thing, we have the first detected case of the B1.1.7 variant. You may have heard of these variants that are out there. They name these variants. And Colorado is famous for having the first variant case of COVID. So some of the infections that you see after people are vaccinated are either potentially a variant strain where the virus has changed its face just a little bit and now it can reinfect just like it's a new virus and the vaccine isn't good against it, or it was someone who maybe had a vaccine and it just didn't take. The other thing with COVID is with a lot of disease processes, the antibodies, that's what our bodies form to keep the virus away, right? To kill it when it gets into us. In a lot of disease processes, these antibodies could even be lifelong, or certainly for long periods of time. Our body has them and we don't get reinfected with the same strain again. COVID, uniquely enough, they found that in some people, your antibodies are staying as short as 3 to 6 months. So almost like a continual need to almost get your body, remind your body, hey, we've got this virus here that we have to deal with. So those are some of the reasons that you've seen some weird numbers with, is the vaccine effective or is it not? Mm-hmm. And you've seen weird numbers with how effective is it? Those are a few explanations for that.
Thank you. And it looks like we have a question from the audience.
We do have a couple questions that are coming in now. The first 2 that I have is, are the vaccines free, and where do I go to get vaccine if you are over 65 years old?
So actually, and this is probably...
Can you repeat that, just in case they didn't
Oh,
hear
yes. So the question is, first, are the vaccines free? And where do you go to get the vaccine? There is a site online, and I did not write it down, that lists all of the vaccine sites. And I'm sorry I don't know that, but maybe Mellissa, knows that, the answer to that, where you go. As far as I know also, it's all subsidized so that no one is to be turned away from getting the vaccine. Now, Mellissa, you can correct me on all that because it's probably all wrong.
Well, we can also tout our own Thornton Fire Department. They are offering the vaccine at Margaret Carpenter Rec Center, and that has been very successful. So there's a call you can call, or there's an online as well. And hopefully somebody can put that in the chat link.
Yes, because we actually have a vaccine event this Friday and Saturday for over 70 on Saturday, over 65 on Friday. And I think Mellissa might want to add to that as well.
I am going to add, I was having a hard time hearing, but our vaccine website, the state's vaccine website, TCHD Vaccine, Google it. We have all the providers listed. We have a provider map. There are new technologies becoming available. Really independent folks gathering all of these vaccine provider appointments into one place. Reach out. We just hired 7 new people in our call center to actively help sign folks up for vaccine, because with our 70 plus, our older adult population, not everybody has a computer, not everyone can drive very far, not everyone can get into a health portal and health records, and so we're actively trying to get folks on lists. You can be 65 plus and still have a hard time finding a vaccine appointment. We're actively trying to get people into those appointments. As more vaccine becomes available, more appointments will become available. I heard a little bit about your vaccine clinics. There are vaccine clinics popping up. We expect facilities like our testing facilities, big drive-through testing, fixed sites that are there always to be available in the next few weeks. And so keep an eye out for information. Visit our website, TCHD Vaccine. It might still be difficult to get an appointment. Reach out to us. Our call center is 303-220-9200. Reach out. We have folks actively trying to get folks appointments.
Thank you. Do we have another question from the audience? We don't. Anybody else in the room want to ask a question?
I do have one question. Do they know how long the vaccine is going to last? Like once you get it, how long are you safe from it? Does anybody know that question?
No, the question is, do they know how long the vaccine is going to last once you get it? And the answer is no, they don't, for a couple reasons. It appears that different people respond differently at this point. So for example, in some of the early studies on nursing home patients receiving the vaccine, they're not mounting an antibody response until much later than younger people, perhaps even a few weeks later. The other thing is that some people manifest a very robust response. Their body just builds antibodies like crazy. In fact, those are the people that are having a reaction to the second dose. They built such a great antibody response. Other people are not. They're building a mild response. And then they're getting really not symptomatic with the second dose because that's what really gives them the antibodies that their body the chance to form the antibodies they needed. So that's a long way of saying that everybody responds differently. We also have this confounding issue now of this virus mutating. There are 3 different strains of it now. And so some of the early vaccines, it doesn't look like they're effective against some of the more recent virus changes. So for those reasons, it's very hard to say how long your immunities will last post-vaccination.
Okay, so we do have a couple others, and I'm not sure if you guys are aware, but we have a whole nother room that is being translated in Spanish. So there's people over there that are also asking questions right next door here. But this one's maybe for Dr. Ramos or Mellissa, and it says, as there is no federal or state safe harbor or indemnification for liabilities for businesses opening or reopening, what are some recommendations for a business owner's protection?
I'll let Mellissa go first on that. I think that's in your wheelhouse, Mellissa, and then I'll add to what you say.
Could you hear the question, Mellissa?
I did. I think I would say do your very best to comply with public health orders. Reach out when you have questions. Actively seek out new information as it becomes available. Again, your regulatory agencies, your trusted business partners, all actively putting out resources to keep everyone safe. And so reach out if you have questions. Let us know if something's confusing. Do your best to comply with your guidance for your business space.
And I'll just add something small to that. Now I'll talk as an attorney, not as a doctor. From a legal perspective, as a business owner, you have a responsibility, a public policy responsibility to do your best with what you know. So you can't be careless or reckless and disregard some basic precautions. You have to make efforts, and particularly when resources are available, because if not, you're just putting a bunch of the population at risk, or you're restricting them from your services because they're afraid to seek them. So as a business owner, you do have a responsibility to at least do your best to comply with some of the easier, what I would call lower hanging fruit compliance things that are out there.
Thank you.
Okay.
Oh, we have one question from the audience, if we can go ahead.
Okay.
Mayor, you hear a lot of complaints about the legal standing of why cities are following these orders and everything. So can you talk about the reason why you have to follow these orders as they come down from Thornton County Health?
And Mellissa can help me with this one actually. So several years ago, there was a state statute put in place that gave the health departments the authority for health orders. And so the Tri-County Health Department is our health department for the city of Thornton and for Adams County, as well as 2 other counties, hence the Tri-County in the name. And they are responsible for all the health orders there. The Adams County Commissioners hold the contract with Tri-County Health, and we partner with our commissioners to make sure that we're managing things as a city, but that we're also following the guidelines that are mandated to us from the state and from Tri-County Health. And I don't know, Mellissa, if there's something more you want to go into for that?
No, I didn't hear the original question, but I'm good if you guys are good.
As long as what I said sounded correct, we're good.
It did sound good, what you said.
Okay, so another question is there a possibility for the vaccine available for people that may not be here legally or immigrants that, don't have insurance? Is that information collected and can they get the vaccine? That might be for you, Mellissa.
I couldn't hear that.
Sorry.
So the question was that if someone happens to be here illegally or does not have documentation, do they still have access to the vaccine? How can they do that? And if they don't have insurance, how can they get the vaccine?
I'm gonna do my best on this piece of that. If they don't have insurance, it does not matter. This is free for everyone. Governor Polis just came out the other day and said that providers should not even be asking for identification. If you feel comfortable providing your identification, please do so. It's important so we know who's getting the vaccine and where. But you do not need insurance. You should not have to show identification. It does not have to be in the county or city that you live in. Everyone who wants the vaccine will be able to get the vaccine, and it is completely free. You do not need insurance. A lot of these vaccinations are at different providers, Kaiser or UC Health. You can go there too. Those, it doesn't matter what insurance you do have or where you go. Providers are required to provide that broadly. And the first part of the question, can you say that again?
If the residents are here illegally or don't have documentation, can they still have access to the vaccine?
Oh, perfect. So I answered that. You do not have to show any type of identification to get the vaccine. And so if you don't feel comfortable showing identification or you do not have identification, you do not have to show that. And you are entitled to get the vaccine and cannot be turned away so long as you are in an eligible category to get the vaccine. So you may be turned away if you don't fit in an eligible category, but not for insurance, not for identification. You should not hesitate to get that vaccine. And if you have concerns or would like to chat through that with someone, give us a call, 303-220-9200. We have staff that are prepared to chat through that with you. We could also connect you with some fantastic community resources, community centers, community partners that you may be familiar with that can also chat through this with you.
Thank you. And I think we have time for one more question.
We're 2 minutes after.
Okay, so we should wrap it up.
Yes.
Well, I just want to say thank you so much to everyone who made this event possible. Thank you to our City of Thornton staff. Thank you to our Business Thornton Advisory Council, many of which I seen here today. Thank you to those that have called in over Zoom. Thank you to my fellow panel moderator, but most especially thank you to our guests. Thank you, Mellissa. Thank you, Dr. Ramos. Very much appreciate both of you participating in this today. It is very helpful to all of us and our community that you guys are part of our community and help us out. So thank you.
Thank you. Thank you for the invite.
So with that, we will say good evening to everyone.